I think we should be very mindful that this variant is important and that we need to potentially think about anybody coming in who has been into South Africa needs to be quarantined. And I think the reason is that the lessons learnt from Hong Kong, where a traveller went from South Africa to Hong Kong, tested negative on the first day and didn't test positive until day 4, and then seems, we're not sure yet about the evidence, but it would seem as if another traveller on the other side of the corridor of the quarantine hotel also acquired this particular B11529, which means that it's highly infectious. It goes through airborne spread. But interestingly, that second person didn't test positive until day 8. So it looks like there's a high spike in viral load, but it doesn't happen early on, doesn't gradually or may not gradually increase, but increase spike rise, which means that it could miss out being tested as positive in those early few days.
Would we necessarily know if this variant had already presented itself in Australia?
Look, I think we would, Kirsten, because Australia does genome testing on samples, which is great. And of course, those samples and results get given to WHO as well. But many countries don't do it very often on regular samples being taken. And that's why I think we only know about a few cases. There could be more, particularly in South Africa, although they do genome sampling, but not on every single swab. And of course, this is a real reminder that in countries that have low support for their health services because, they're low-income countries, this may well have come from somebody who wasn't given proper treatment for HIV, and it may have got into somebody, this is the hypothesis at the moment, who had HIV, and that this virus has learned how to make 32 mutations around that spike all at once. And this is really not very good for South Africa and not potentially good for the rest of the world. So it's a real reminder that the whole world needs to be vaccinated.
And so what happens from here in relation to this variant? Will the World Health Organization now be looking at what the South African health minister had to say overnight? And what is the process before the WHO would decide to declare this either a variant of interest or a variant of concern?
So at the moment, it's called a variant under monitoring or under investigation. And so the WHO will meet with expert virologists and decide, has it impacted the vaccine efficacy? Has it impacted diagnostic tools or impacted therapies? Is it more infectious and more deadly? So if it passes any of those and multiples of those, it will be moved into a variant of concern. Otherwise, it'll be parked potentially under let's watch this space or in a variant of interest. And there are 2 variants of interest, the Lambda and the Mu, and of course about 8 variants of concern, from 2020 and 2021. But this has only a small number, but it's a lesson that I think the virologists are taking very seriously. But epidemiologically, we haven't noticed any change yet in whether or not it's more deadly, it affects children more, it's more infectious. So that's where the virologists will need to get together to talk about those issues.
Australia's vaccination rollout as a whole is now very advanced, and New South Wales is fast approaching the point where the majority of COVID restrictions, such as density limits and masks, will be dropped. With international arrivals, or some international arrivals, now no longer quarantining, you mentioned that we should be mindful. Do you think that Australians can afford to live as freely as some have begun to do, given what we're seeing with this new variant?
Well, what surprises me, Kirsten, is a common error, I think, not just in Australia but around the world, where, of course, they've looked after the elderly, vaccinating them first and giving the booster to them first. But what Australia and the rest of the world have failed to appreciate is really simple epidemiology. You do not need a mathematical model to work this one out, that the 20 to 39-year-olds represent about 68% of all Delta cases. So, we need to think about vaccinating and boosting the young, but getting their vaccine shots up a bit higher. So across Australia, the 12 to 39-year-olds have only reached 69% of full vaccination. Now, I know that there's about 9% that have had their first shot. That's great. It gets them into the 70%, but it's not enough. And, of course, when you look at what vaccination of 12 years and over means as a total population coverage, we've really only met about 69% of our total population. So if something even more infectious and potentially more deadly should get into the population, it could circulate more easily than we would give it credit, because only 69% of us are fully vaccinated. So we really do need to think about vaccinating the 5 to 11-year-olds, and that will increase the herd immunity or that herd level closer to 90%, and then we really would be safe.